It is my pleasure to introduce to you Dr. Surakshith Battina, MD, the founder of Indigo Women's Center. He is a pioneering figure in the field of medicine, having performed the world's first documented laparoscopic management of uterine rupture. His groundbreaking work has earned him international recognition, including the prestigious ICON Award in 2019. Dr. Battina's commitment to excellence is evident through his extensive qualifications, including being a FICRS scholar in the United States, completing a fellowship in minimally invasive surgery in France, and pursuing fellowships in reproductive medicine and cosmetic gynecology in the United Kingdom and India, respectively. Notably, Dr. Battina's expertise have garnered attention beyond the medical community as he received an offer to showcase one of his surgeries for the television series Good Doctor Season 6. Please join me in welcoming Dr. Surakshith Battina on the stage.
So what if I had to ask you, what is the most beautiful moment of a couple's journey together? What would it be? It would of course be the moment when they bring their beautiful baby into this world. But what if this moment is ripped away from them by a condition they haven't even heard of? That, ladies and gentlemen, is cervical incompetence. Now, cervical incompetence affects 1% of all pregnancies, and when you look at 1% in the Indian population, that is 4.85 lakh pregnancies every year. Why does this happen? It happens when the cervix, which is the lower part of the uterus, becomes loose. It's unable to hold the pregnancy, and after 20 to 24 weeks, the whole pregnancy is aborted out. And that is such an emotionally draining experience for the mother. And the problem is, there is absolutely no way to predict this condition. And many of these women undergo 3 to 4 pregnancy losses before they realize that they're having a problem and seek treatment because of the lack of knowledge. Now, in terms of treatment, what do? We have, of course, we want to go ahead and we want to suture the cervix. And this can be done through 2 approaches, the vaginal approach, wherein we go in through a very tiny space, go ahead and suture the cervix, but unfortunately, because this is a very small working area, the suture is placed much lower down, so it has a very high failure rate. The other option is the laparoscopic option, wherein we place the suture much higher up, but unfortunately, it requires a lot of skill to perform, and also it requires a dedicated team for this. Now, ladies and gentlemen, you need to understand that there's a lot on the line over here. We are not just talking about one life. We are not talking about the mother's life alone. We are talking about the mother's life and as well as the baby's life. And I'm happy to say that we have done around 48 such procedures, and all of the families have taken back home a healthy baby. Now, this is one such couple who have actually had a cervical incompetence, and we went ahead and did the procedure for them, and they named their baby after me. Now, this is such a proud moment for me. Okay, I think nothing will give you much more better satisfaction than something like this when it happens to you. Let's talk about another case. We have this situation where the uterus burst open when the woman was having labor. That is a condition called as the uterine rupture. And when that happens, of course, the clock is ticking, and the woman's life becomes in jeopardy. So at which point we were able to go ahead laparoscopically remove the fetus, because the fetus was in the abdomen, and then we were able to suture the uterus back and we sent the patient home. Conventionally, what would have happened in this particular situation is that we would have to do an open surgery. The patient might sometimes even have to lose her uterus. Now imagine the amount of physical and mental trauma that she has to undergo if that happened. She has to be in the hospital for 4 to 5 days because of the open surgery, and also the emotional stress that she will never be able to conceive again. But our patient, thankfully, was able to, go back home the very same day because it was a laparoscopic surgery. And also, 2 years later, she came back to us after she conceived naturally, and I delivered her as a normal, as a C-section in my hospital. That's a baby over there. So I've also uploaded this procedure on YouTube, just so that I was so happy I was able to do this laparoscopically. And then I realized, after reading through all the comments, that there was no other procedure ever performed anywhere else in the world like this. And I got to thinking, maybe is this, so I had to do some fact checking. So I went ahead, checked the PubMed, checked a few studies, and then I realized I am probably the only one who has ever performed this procedure ever in the world. So this again is a very proud moment for me and my team. Let's talk about another condition. A woman, usually a girl, when she is born, she has around 1 million follicles. Follicles are nothing but eggs. Okay, they slowly keep depleting as she gets older, and by the time she hits 50, she goes into menopause, which means she has no more eggs or follicles left. Women with premature ovarian failure, they lose these eggs at a much more rapid rate, and by the time they're 30, they absolutely have no eggs at all. So our patient had the same condition. She had tried 3 to 4 cycles of IVF, but unfortunately, it was a failure. It did not work out for her. So her only other option was to go in for a donor egg, where they take the embryo or the egg from somewhere else and then they transfer it into her for her to conceive, but she was not willing for that. So that's when I proposed to her about this procedure, wherein we take the stem cells from a bone marrow and then inject it directly into the, into the ovary again, in hopes to rejuvenate the ovary. And 2 months later, she called me and she said that she conceived naturally. So again, this is another proud moment for us and our team. But you need to understand that this journey was not always straightforward. There was a lot of ups and downs. So my name is Dr. Surakshith Battina, and I'm going to talk to you about my journey today. So, of course, you all would have understood from now that I'm a gynecologist, isn't it? Whenever you say gynecologist, women already run away from them. And then if it's a male gynecologist, they run away even more faster. Not only that, in India, just like how your properties are inherited from one family from one generation to another, just like that, even your family doctors are inherited. So it's very difficult for someone like me, someone new, to just come in and introduce myself into that. So it was an upward struggle for me, but women's healthcare was always my passion. So I somehow wanted to get good at it and make sure that everybody else knows that as well. So fresh out of MD, I had one of 2 options. Either one, go ahead, sit in a corporate hospital, make a good living, go up the corporate ladder, and possibly make a lot of money. The other option, of course, was to go ahead and train myself, and hopefully to improve my skill and hopefully to serve my patients better. Because there's a lot of hopeful in there, because not many people are very good to gain that skill at the end of their training season. So during this time, also you need to understand that we will have a 0 or negative bank balance. And also during training, I've learned a few more things. I have understood that it's just not important that you as an individual are good for your procedures. You also need to develop a whole team who also have the same vision as you, and as well as you need to have a setup to be able to enforce your vision. So I went ahead and I started doing the thing what everyone does. One good thing about being a doctor is the banks are always ready to give us loans. Okay, so I was able to take out 3 loans, and probably that is one of the biggest risks I've taken at that point of time. And I started building my dream hospital or the dream setup. Initially, I had absolutely no idea about architecture, but as I was going through, this whole process, and towards the end, I was able to construct my dream hospital, and I was telling the site coordinator on what materials to use, because those things they don't teach you in medicine. So now that I had a hospital, I was thinking, what next? How do patients just come inside? There's a lot of learning and unlearning that you have to do to know how to educate the public. And, for a few years, things were going okay. And then suddenly, COVID happened. Nobody wanted to have babies anymore. And also people were, they were postponing their surgeries to later dates. So I had a lot of time in my hands. So during this time, I decided, you know what, I'm going to dedicate myself to, getting more healthier, getting more fit. And I started this page called Dr. Baby Maker on Instagram. So the moment I say Dr. Baby Maker, people's minds go everywhere, no? But no, the reason why this name comes in is because, we as reproductive medicine specialists, we make babies in the lab. As in, we take the single sperm, we take a single egg, we make the pregnancy outside, and then we later put the pregnancy back inside. That is called the IVF. So that's how, you would all heard of the term test tube baby, isn't it? So that's the word, test tube baby, Dr. Baby Maker comes in. So initially, I hated doing these videos. I found it too cliche, I found it too, cheesy. What am I doing? Why am I doing this thing? And also, I was also concerned about what my colleagues will think of me. But I think as I went through the months and years, things got a little more easier. And fast forward to 2024, this page is now doing around 120,000 followers for just someone who's talking about women's healthcare. And you know what? It's not just a number. What I want you to get out of this is that so many 120,000 people were being educated about women's healthcare. And that was my main takeaway from all of this. Not only that, because of this, so many other opportunities have opened up. I had the opportunity to go and showcase one of my surgeries for the Good Doctor Season 6. And I'm here today giving this talk to you on the TED stage. So ladies and gentlemen, my point is this. Throughout my endeavors, I didn't have any financial gains as my main focus. I was trying to focus on trying to add value on, into other people's lives. At the same time, also improve my skill, and get better at what I'm doing. So if you touch people's lives in meaningful ways, it will also open up opportunities for you, no matter what field you are in. So definitely give your best and, try to touch other people's life in meaningful ways. Thank you so much.